ओम धम धन्वंतरे नमः। रागादिरोगान् सततानुशक्तान् अशेषकायान् प्रसतानशेषान् औत्सुक्यमोहान् निदान् जगान योपूरवैद्याय नमोऽस्तु तस्मै. Let me share. So, topic is Gokshuradi guggulu, its clinical indications. So, Gokshuradi guggulu is one type of guggulu preparation where Gokshura bija churna is also there. And it is usually given in renal disorders and pain management, joint disorders with painful joint disorders, and in hyperlipidemia. So, guggulu preparations are commonly used in clinical practice by Ayurvedic physicians in India and worldwide also. These preparations are used mainly in pain management and inflammatory conditions. Yogaraja guggulu, Kanchanara guggulu, Kaisara guggulu, Simhanada guggulu, Triphala guggulu, Medohara guggulu, Saptavimshati guggulu, Ekonavimshati guggulu, Trayodasham guggulu, and Navga guggulu are few guggulu preparations which are frequently used by physicians. Guggulu has actions like Rasayana, Medonilahara, Kapavatahara, Vedanastapaka, analgesic, anti-inflammatory, anti-infective, immunomodulator, hypocholesteremic, thrombolytic, and anti-atherogenic actions. It is widely used in a variety of disorders. Gokshuradi guggulu is one such preparation which is used in renal diseases also, as Gokshura, that is Tribulus terrestris, is Mutrala in action. The present paper highlights about the clinical indications of Gokshuradi guggulu in an experiential and scientific view. So, Ayurveda medicines are popularly used by physicians, usually in non-communicable disorders. Guggulu kalpa formulations are a group of drugs which contain guggulu as the main ingredient. There are several guggulu formulations which are having different ingredients upon which its indications vary and become specific. So, Kaisara guggulu is given in Vatrakta and painful disorders of this and skin diseases, whereas Yogaraja guggulu is given in Sandhigata Vata. Gokshuradi guggulu contains Gokshura bija churna, which is mainly has diuretic action. Hence, it is given in Shota Yukta disorders like bilateral pedal edema, chronic renal disorders, and Johnson-Nigata Vata. So, this is the structure of the knee joint. You can see the bones like femur, tibia, fibula, and patella. They are seen with the ligaments. So, this is the lateral view of the knee joint. So, this is X-ray. You can see the osteoarthritis of the knee joint. You see the decreased joint space in the knee joint and sclerosis in the surface of the articular surface and osteophytosis at the periphery. So, this is a lateral X-ray of the osteoarthritis of the knee joint. You can see the bone erosions. So, Gokshuradi guggulu also acts on the atherosclerosis, dyslipidemia and atherosclerosis or arterial sclerosis. So, this is the fat accumulation in the wall of the intima of the arteriole and causing atherosclerosis. And guggulu being hypolipidemic action and anti-atherogenic acts on the atherosclerosis. This is the histology of the artery. You can see tunica intima, tunica media, and tunica externa are there, and usually fat accumulates beneath the tunica intima in atherosclerosis. And in bone, painful joint disorders also, Gokshuradi guggulu can be one. This is the histology of bone with the Haversian system. Okay. So, let us see the ingredients of Gokshuradi guggulu. Shunti, ginger officinale, pippali, piper longum, maricha, piper nigrum, haritaki, terminalia chabila, vibitaki, terminalia bellerica, amalaki, ambelica officinalis, mustaka, cypress rotundus, and guggulu comifera mukkulu. And if you see the actions, if you analyze the actions, Actions of Gokshuradi are Vatahara, Medonilahara, Vedanastapana, anti-inflammatory, analgesic, Shotahara, Deepana, Pachana, Ushna, anti-infective, antibacterial, bactericidal, antithrombogenic, hypocholestemic, thrombolytic, blood thinner, antiatherogenic, diuretic, and thyroid stimulating actions. Now let us see the indications of Gokshuradi Guru. Nephrotic syndrome, chronic kidney disease, benign prostatic hyperplasia, urinary tract infections, osteoarthritis of the knee joint, lumbar spondylosis, cervical spondylosis, lumbar spondylolisthesis, sciatica syndrome, rheumatoid arthritis, ischemic heart disease, bilateral pedal edema, general anasarca, left ventricular failure, calcaneal spur, backache, fibromyalgia, cerebral atherosclerosis, coronary atherosclerosis, old myocardial infarction, myocardial ischemia, and frozen shoulder. That means with the different disease with adjuncts, it can be given varied type of disorders. That is known as amayika prayer. Like Gokshuradi can be given in nephrotic syndrome with Varunadi Kashaya, Amritadi Vata, along with high protein diet and salt and water restrictions. In chronic kidney disease, it is given with Varunadi Kashaya, Bhujanti Basma, and restrictions of sodium and water. In benign prostatic hyperplasia, it is given with Varunadi Kashaya and Gandhaka Rasayana tablets. In urinary tract infections, it is given with the Chandanasava and Gandhaka Rasayana tablets. In osteoarthritis of the knee joint, it is given with the Navajivana Rasa, Maharasana Kashaya, Janubasti, and Matravasti. In lumbar spondylosis, it is given with Maharasana Kashaya, Visheshandagavati, and Mahanarayana Tail application. Kati Basti is given in some patients. In cervical spondylosis, it is given with the Vishamushtivati, Maharasana Kashaya, and Griva Basti. In lumbar spondylolisthesis, it is given with the Navajivana Rasa, Maharasana Kashaya, Kati Basti, and Matra Basti. In sciatica syndrome, it is given with the Visheshandagavati, Maharasana Satta Kashaya, and Kati Basti. In rheumatoid arthritis, it is given with the Rasna Erandadi Kashaya, Mrityunjaya Rasa, and Amavateshwar Rasa, Valuka Sweda, and Ksharabasti. In ischemic disease, it is given with the Pushkara Ugulu, Arjunarishta, and Lashana Kshirapaka. In bilateral pedal edema, it is given with the Purnamadi Mandora and Purnanamasava. In general anasarca, same medicines is given. In left ventricular hypertrophy and failure, it is given with the Purnamadi Mandora, Prabhakaravati, and Arjunarishta and Purnanamasava. So in backache, it is given with the Rasna Panchakashaya and Dhanantara Taila Matravasti. In fibromyalgia, it is given with the Ashwagandharishta and Nadisveda. In general atherosclerosis, cerebral atherosclerosis, it is given with the Rajvachintamani and Ekangavira Rasa. In coronary atherosclerosis, it is given with the Lashana Rasayana and Arjunarishta. In old myocardial infarction, it is given with the Pushkara Guru and Arjunarishta. In myocardial ischemia also, same medicine is given. In frozen shoulder, it is given with the Navajivan Rasa and Maharasana Kashaya. Nasya is also practiced. That's it. Having to discussion. Gokshuradi Guru is a guggulu kalpa formulation commonly given in renal disorders and pain management, especially painful joint disorders. It is also effective in Shleshma Medogata Rogas. As Gokshuradi is a diuretic drug, it is given in disorders associated with the sodium and water retention, like bilateral pedal edema and general anasarca. It is also given in left ventricular failure, pulmonary edema, and diseases with the pain. As it is Medonilahara, hypocholestemic, and antiatherogenic. It is also given in ischemic heart disease, acute myocardial infarction. Of course, myocardial infarction you have to give supportive treatment, modern treatment, because it is a serious disorder. Shota and atherosclerosis. It can be given in nephrotic syndrome, chronic kidney disease, and hypoproteinemia. It is given with the high protein diet in such cases. Coming to conclusion, Gokshuradi is a guggulu formulation which is given in Shota Vedana Yukta Vyadhis like osteoarthritis, rheumatoid arthritis, lumbar spondylosis, etc. Since it has diuretic action because of Gokshura, it is given in disorders associated with the edema like left ventricular failure, pulmonary edema, sodium and water retention cases, and bilateral pedal edema. It has least adverse drug reactions. Symptoms like petechiae, ecchymosis, itching all over the body, and constipation are seen in some cases with prolonged use of this formulation. So these are the references. So thank you for patient hearing.